Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Paul Wilder. He's executive director at CommonWell Health Alliance, and Liz Lewis, director of products at CommonWell Health Alliance. Welcome.
Thanks for
Thanks
having
for having
us.
us.
Yeah, excited to have you here. Our annual tradition here at HIMSS to come together and hear what's the latest with CommonWell and healthcare interoperability. But before we go there, Paul, why don't you start us off? Tell us about yourself and CommonWell Health Alliance.
So I'm me, I'm the executive director of CommonWell Health Alliance. We are a health alliance. We are a trade association, membership association, made up of mostly health information technology vendors, a lot of EHRs, a lot of aggregators, things that are doing great things with data, and we're having a great year, going strong. A lot of things are going on in health IT. A lot of things are going on in health data sharing. We see a lot of AI going on right now. We got to help enable these things to do better work, and excited to be here. But thanks for having us.
Awesome. And Liz, how about yourself? Tell us about yourself.
Yeah, so I'm Liz Lewis. Recently, changing my name, same me. And I'm director of product at CommonWell, so I help to make sure that our vision together for where the alliance needs to go, along with our members, our stakeholders, makes sense and that we're going in the right direction. I think we're going to share some of those exciting ththings with you today.
Awesome. So, Paul, healthcare is changing really quickly, and I think even more so with AI lately. Lots of policy changes. It's a crazy time, I think, right now. How do you think that it's impacting health data sharing?
It's surprisingly not that much.
Yeah.
Right? We've been on an upward trajectory for years. Like when I got here, it was millions. We talked in millions of documents moved. Now we're talking in billions.
Wow.
I don't think we're getting to trillions quite yet, but maybe by the time we're done. There's a lot of uncertainty about what's going on in general, right? So we see changes in the Department of Health and Human Services. We see hospitals not knowing what to do, but it doesn't mean they're sitting there doing nothing. So we still have a strong membership population. We still have 261 million people in our database that we know where their records are, and they're exchanging at scale every day. This is all about trust. I do not think what's going on and the uncertainty has changed the trust paradigm. Like we're still doing what we do, and data is moving to the benefit of patients, providers, and everybody else.
Yeah. Liz, what would you add? What does this rapid change mean for those that are invested and interested in the future of health data sharing, which quite frankly seems to be everyone, but
It does. So we talk to people here at HIMSS about those who are already connected want to do more with the data. It's not good enough anymore to just get the data. They need to be able to do something meaningful with it and actually use it. But then we talk to other people here who are not connected to anything really, which is crazy today, 2025. It absolutely is possible.
Wow.
And so there's a really kind of long tail of smaller, one doc shop, 1 to 3 providers who are not connected, who are not getting the benefit of knowing more about their patients outside of their own practice. So I think those two things sort of together are a lot of what we hear here at HIPS.
Interesting. I wouldn't have thought that. I guess it makes sense. If you're connected, let's do more, right?
Absolutely.
That's a strong
Make
feeling.
it better for me, make it more usable. But then we talk to people too who are like, I just need to get connected. That's why we're here.
Yeah, we can do that too. What else do you see on the horizon for CommonWell, Liz?
So the past 18 months have been a whirlwind for us. We rebuilt our entire platform. We didn't advertise that too much, but we both have been here for a little over 5 years.
Wow.
And we learned a lot about what worked. And so it was really a fun time for us to take all of the good and kind of cut away the stuff that wasn't working and make something new and fresh. And so because of that, I think that we now have an opportunity to sort of re-inform the market about what it means to do national data exchange. And I mean, there's some other things I won't spoil that you can say next, right? About things that are on the horizon, things that we're doing, things that we launched here at HIMSS. But I think some of the key things, like I said, are just making that data more accessible and making it easier for some of those provider organizations to come on board.
Interesting. And became a human in the process as well.
That did happen. Yes.
That's amazing. Well, Paul, talk to me about the opportunity for payers that you see in this current health data sharing landscape. Are they interested in being participants in this? I know in the past you were mostly providers, but what do you see on the payer side?
Yeah, we almost have to apologize. We're talking about just the clinical flows, right?
Yeah.
Because it's still very important, it's still growing. It's still the most important thing we do, right? But it turns out that there's this thing called paying for stuff and claims and
People want to pay for
transactions, and it needs data too. And it's not just payers, by the way, right? There's Social Security Administration, veteran benefits, life insurance, right? You need clinical data to do a lot of stuff.
Sure.
And we're pretty excited about the opportunity to go there, right? It seems like, oh, we do all this provider stuff all the time, and now we have patient access moving at scale now too. So great, get providers data, get patients data, and now make the administrative flows easier. Get data to payers. And so we're seeing a lot of interest in taking the tracks that are laid and getting it over to scale to get to payers as well. So I think this year is going to be a pretty seismic shift on the amount of data we're sharing around for good causes.
Yeah.
I think one of the things that we also want to try to bring in related to payers is solving for prior authorization. I mean, to your point, we have the groundwork laid. And I think that, patients ultimately benefit from a more seamless prior authorization flow. We both have stories about issues getting things that we needed approved and having to fight for that. So I think that's definitely something that we're interested in and we think would be a great value add.
Well, since you said that, I can't not riff on that. So, yeah, that's true. And what's interesting, a lot of prior auth is done by a provider making requests, right? So they say, you need X drug or lab done.
Sure.
But the reality is to approve it, you actually need data from multiple entities, right? So in my case, I have a very expensive medication I take that required my pulmonologist, an ophthalmologist, and my ENT to coordinate on getting that approved. And without a network and without a way to get to that data, really hard. I know because I did it manually. Unfortunately, I had a very nice pulmonologist who went through and wrote it all down and wrote a nice letter to my payer to make sure I got covered. But not everybody has that time or knows how to do it. So we got to get this done better.
Yeah, I mean, it's interesting to highlight how the data is the key to the prior auth and where
Absolutely.
is that data. To your point, it's across multiple organizations that they often don't control, as much as some EHR vendors may want to.
Sure.
Right.
Interesting. Well, last year when we spoke, Paul, you talked about CommonWell's work to create a marketplace. I think that idea fascinating, a marketplace on top of the data sharing. Talk to me more about that and where are we at in the marketplace?
Well, it launched. So Tuesday, a press release went out. It's real.
Awesome.
Basically, we are doing a lot of exchange, right? The scale is massive. It's not just us, right? So we have massive scale. There are some QN partners that are doing a lot. But there are a lot of entrants that don't necessarily know what's about to hit them if they join. It's a lot of data. Some of it's very complex. Some of it's got duplicate data. I mean, think about it. Every doctor you've ever seen, you gave the same pieces of data. Your allergies, your immunizations, prior diagnoses, they all have the same stuff. So when you get all that and it's duplicated and it's kind of a mess, some providers don't know what to do and some EHRs don't know what to do. So our first use case in the marketplace is a normalization and data organizer.
Okay.
Now, we are a trade association. It's in our DNA not to compete with the market. Our DNA is to make the market work better. So the marketplace allows for people with really cool tools to inject their tools into Interop and make the receivers of data and the requesters of data work with the stuff better. And so our first partner is clinical architecture, with obviously our service provider being LK and us. And we have that exact use case working right now. So it's pretty amazing. What it does, very simply, is take a blob of data. Say there's 51 documents about you in the Introsphere.
Sure.
Takes it and makes document 52. And document 52 is an organized document that is appropriate to the receiver, right? So sometimes a nephrologist wants something different than a pulmonologist. Bubble that up to the top, organize it, and make the interrupt work better.
Wow.
We have talked about data usability at CommonWell for years. And we've gone round and round about, we know that this is so important to do.
Yeah.
But it's, again, it's not in our DNA. We don't touch the data. We don't have access to the data. We move the data. And so bringing on a partner like this really doubles down on, I think, our mission of making sure that the data is usable at the endpoints. Because to your point, if you get 51 documents, there is no provider that has the ability to have the time to go through 51 documents for one patient when they have 15-minute appointment windows.
Sure.
There's just, it's impossible. And so we also have been a data usability, data quality advocate for many, many years. We've partnered with others in the industry, including the Sequoia projects, data usability and taking root movement to make sure that we're spreading the word about how significant this is.
Yeah, one thing I did skip, and Liz hinted at, but actually there's one extra step. It's not just organizing it for a provider, it's organizing for the systems that are getting it.
Yes.
Right, so interoperability is supposed to be about a machine, a computer, being able to have data it can work with. And what does a computer do? What does an AI do when it gets 22 copies of someone taking acetaminophen every day at 100 milligrams? Are they taking 2,200 milligrams of acetaminophen?
Yeah.
Or is it one entry that's been duplicated 22 times? And that's hard.
Yeah.
And it takes really good data science to understand that. And the new entrants need help.
Absolutely.
Well, I assume as a marketplace, you'll be looking for other marketplace partners. Do you have some areas in mind that you're looking at, or are you kind of interested to see what the market has and would bring to the table?
It's funny. Someone asked me a similar question. They said, what do you think is going to be next? I don't know. Right? I mean, you go around the floor. We're at HIMSS right now. There are a ton of people doing crazy, interesting things. And I say just come on over,
Yeah.
right? Because we can't invent everything. Not everybody can invent everything. No EHR has every tool
Sure.
perfectly baked. There are we want people to exchange their best ideas with each other, right?
Yeah.
The best way to get best of breed is to collaborate, and work together. So yes, I have a couple ideas. Like I think you mentioned payers. Payers need to organize data differently than clinicians. It's just a fact. Is it good, bad? I don't know. It's just a fact. Patients need the data organized differently because they don't speak doctor. Right? I didn't go to med school. I can fake it if you want me to, but it requires a different level of this was a cream for a rash versus some Latin sounding name for some Latin sounding name diagnosis, right? So we need to simplify the way we do healthcare to get everybody involved, do it accurately, and improve it.
Yeah. Well, let's talk about that a bit more, Liz. Like he talked about patient access is a reality now and a requirement that we need to do, and it's going to get bigger as patients understand what's available and what's possible. What are some things that data sharing stakeholders should be thinking about to ensure kind of this seamless, safe access to data for patients?
Yeah, that's a great question. So we have been talking about patient access for years. CommonWell supported it since almost day one of CommonWell existing. But that doesn't mean that the industry, the ecosystem that we live inside of supported it. We've talked a lot about how do we make sure that the data that's coming to me as a patient is really my data? Because we do need to be sure, right, that we're only disclosing information to the right person, especially when it's a patient and they're not a covered entity. So we require an identity verification that takes place. Take a selfie, make sure that I really am Liz before I can go through the process of getting my data. We've demonstrated this. We've talked about it in many different places. We had a talk on it yesterday.
Well, we got huge applause.
We got huge applause. And
That's awesome.
we've had increasing membership support. We have some of our smaller to mid-size members who have supported this for years and sort of flown under the radar, and we haven't really applauded them the way that we should because we've been so focused on making sure that we get some of the big players who have a lot of the data to support patient access so that when I come in and I want to know about myself or I want to know about my minor child, that I have the ability to do that. And so Athena Health actually has recently said they are going to fully support patient access as transition over to our new platform, which is really exciting. We've seen it work in real life. We've seen it work safely. And so one of the biggest things that I would say, and I would challenge the industry is don't put extra burden on the patient unnecessarily, right? We work in this space. arguably we know a lot about healthcare technology. And if it's difficult for us to know all of the places where our data is, imagine somebody who doesn't work and live and breathe inside of this ecosystem. It's hard. It's hard to know where all of your data is. I certainly don't know.
Yeah.
And so we need to rely on the tools and the technology to be able to do that in a safe and secure way and remove as much manual burden and remembering as possible from the patient.
Yeah, I think every time you hear someone in a leadership role say, patients don't know what to do with their data, question back and say, so what? Give it to them anyway.
Absolutely.
But you might be surprised what
Not
they'll
your
do
question.
with it. Yeah, it's the
Yeah.
wrong question.
Yeah.
The wrong answer.
Absolutely.
What's also fascinating to me is that I think most patients feel like the data is already being shared. And I've met so many patients that then when they become a chronic patient generally, they realize, oh wait, that's not happening. I have to do this,
Yes.
which is why I need my access to
Which
my
is
data.
why we are so serious about this use case and making sure that patients have access, because God forbid, that happens to one of us in our lives. We've been fighting for it because we know that that's very real. As soon as you get a cancer diagnosis,
Yeah.
go get your data. This person who's just had their life shaken,
Altered.
you go figure it out because it's too difficult.
Yeah,
we need to
but-
make that easier.
That's right. You have to advocate for yourself. Right?
Absolutely.
On page 42, there's one little line that might be really important.
Yeah,
And on page 42 of a 200-page document, the doctor might miss that.
sure.
And sometimes you have to say, yeah, this thing over here, I need you to
matters.
focus here for a second because I'm
Absolutely.
having an issue. And sometimes a small issue is a much bigger issue that you don't understand yet. So it's not like, you know how to fix it. You're not the doctor. I'm not the doctor. Maybe you were. Maybe
No,
you're
I'm
not.
not either.
But you need to help them, the guideposts, and say, I'm having trouble with my knee. Well, that's not, it's right here. Tell me more about that. You help focus on your real issues by having a good interaction with data.
Yeah, I love it. Well, Paul, Liz, this was really interesting and insightful. If people want to learn more about CommonWell Health Alliance and how they can participate in the marketplace or even data sharing, where can they go for more info?
Yeah, so they can just find us online, CommonWellAlliance.org. You can reach out to us. Membership email, membership@CommonWellAlliance.org. Google Commonwealth, you'll find us. Come by, talk to us. We love to have conversations about the art of the possible. What can we do to make this better? So we'd love to reach out. Yeah.
Awesome. Well, thanks so much for talking with me. It's always interesting to see this evolution, especially with everything that's happening in the world these days. But I'm with you, Paul. I don't think it's changed that much from a data sharing standpoint yet. So, onwards and forwards we
Absolutely.
go. So, thanks so much. And
Thanks,
thanks everyone for watching
John.
and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks so much.
Thank you.
Thank you.
Great.